Good afternoon. This is Senator Addie Eckardt reporting from Annapolis. Another busy week. This week, the bill review is stepped up. We had 26 bills in our committee to review from all kinds of tax credits, and including a cigarette tax increase, which was interesting, that went on for a couple of hours with many witnesses very passionate about using those funds to deter and interfere in kids smoking. We also did a lot with death with dignity. That bill was heard, very passionate, long, involved hearings. Concerns on both sides. I think many people really want relief from pain and suffering, and this bill would authorize physicians to help people to die. I have difficulty with the bill in one way because in my nursing career I've seen a lot of pain and suffering, and ever since I've been involved with the Maryland General Assembly, there has been a lot of effort put forth with advanced directives. That is, giving individuals the opportunity to make decisions about how they want to live their life as they approach the end of their life, which all of us will do. I think it's very important that we use this as a wonderful opportunity to think about how to finish up, wrap up life's business, if you will. In Maryland, we do have advanced directives. We have the MALST form, which is an opportunity to go online and be able to indicate who you want to make decisions, what kind of decisions you want to be made, and I think it's important, as members of my family have done in the past, that when you do an advance directive or you do a MALST form, that all healthcare providers helping you deal with your illness and your health have access to that information so your decisions can be honored. It's an awkward situation to be left when things happen suddenly and then folks do not have a plan of action. That's where there's a lot of uncertainty and I believe a lot of pain and suffering. The advent of hospices around the state for years, with the beginning of that movement with Edith Kubler-Ross, providing folks kind of comfort care as they approach the end of life or with a terminal diagnosis, in being able to provide those kind of comfort measures and also to honor those end-of-life decisions is very important. And we do have a robust hospice network. We don't always have the adequate funding for many of those services, but in most places, the community has stepped up with a lot of fundraising to be able to have hospice houses and to have both inpatient and outpatient hospice care. Palliative care is another new step that can help with pain and suffering as folks deal with terminal illnesses and end-of-life decisions. This is Senator Addie Eckardt reporting from Annapolis.